So today we're going to talk about routes of administration, and this was taken from small sections of chapter 11. We will discuss this a lot more. You have a whole entire class on medication administration and injections and next semester. So this is just an overview. I wanted to give you an idea and for you to have a knowledge, and it will be a working basis throughout the year. So routes of administration, I basically took this from Wikipedia because I thought it was a good definition that explained it. So it's a route of administration in pharmacology and toxicology is the path by which a drug, fluid, poison, or other substance is taken into the body. Routes of administration are generally classified by the location at which the substance is applied. Common examples include oral or intravenous administration. Routes can also be classified based on where the target of action is, and actions may be topical or enteral and delivered through the gastrointestinal tracts or the parenteral, which is what we talk about when we do injections, or also given through the GI tract. Routes of administration and dosage form are aspects of drug delivery, which is why we're talking about it in our pharmacology class. So safety with medications taken by patient, you'll see in this section that they talk about if you are doing documentation, it's important to document the excessive use of drugs or alcohol. Also documenting any tobacco products and over-the-counter or herbal products. Also, instruct patients in dangers of self-medication. We see this a lot with self-medication used with prescription medications and other types of drugs and alcohol. Inform the patient of over-the-counter medications that contain low doses of medication and may not supply the adequate amounts. And discuss how over-the-counter medications contain more than one active ingredient so that they understand when you're doing patient education that they can understand how the over-the-counter medication works as well. So when we look at the medication administration side, medication administration is giving a dose of medication to a patient. You need to have the proper knowledge of the medication, how you're supposed to deliver the medication, and follow the safety precautions when doing so. And we keep quality assurance standards of excellence, so we'll be talking a lot more about that and talking about all the records that we keep and how we test our supplies. And again, we'll go into far more detail over the year. This is just an overview for you to have the basic knowledge and treat. So we've talked a lot about already in our other class, in our ALH4, about the Occupational Safety and Health Administration, and they have the standards in medication administration, which goes right along with what we've been practicing. You want to make sure to wear barrier equipment if there's a possibility of any of the splashing or spraying of blood or bodily fluid. We do wear gloves when giving an injection, and we've already actually talked a little bit about that when you filled out your blood-borne forms this week or last week now. And make sure to place all equipment coming into contact with blood or bodily fluids into the infectious waste container, the biohazard container that we have been using in class. Also, we only give medication that has been ordered. We need to know what medication is being given before we give it. We calculate the doses in a quiet area and make sure that you have someone recheck you, because a difference of a small amount can make the difference of a very hazardous situation and possible death. We always wash our hands and use that proper medical asepsis. We don't handle medications. We make sure that we use those barriers. We use gloves in order to handle the medication as not to contaminate. Before you give a medication, you always identify your patient. We always ask about possible allergies beforehand to prevent a hazardous situation. Observe your patient for adverse reactions. And many of the medications that we administer, there's a waiting period of 10 to 15 minutes where the patient doesn't leave the office, and we make sure that they don't have any adverse reactions before we send them out. And we always document any reactions if they had it. And the most important thing is that if any error has been made, that we report that to the physician immediately. I know sometimes it can be kind of nerve-wracking and you're afraid you might lose your job or something might happen and you might be afraid of the consequences. But again, we're talking about the safety and the life of a patient, and I will share some stories with you in class regarding this situation, and it is always, always important to immediately tell the physician of any errors made. So the 3 befores are really important. Anytime you're administering a medication, you need to read the label 3 times. So when you're taking it and you're about to remove it from the drug shelf or the drug, sometimes they're in cabinets, you want to make sure before removing the drug from the shelf that you look at it, you observe it, and you check it. And then before you prepare the medication for administration, for example, if you were giving 200 milligrams of ibuprofen, you want to again check before you take out the 200 milligrams of ibuprofen. You're going to check the medication labels there. And then as you're putting it back into the cabinet or the shelf, you always check it for that 3rd time. So the 3 befores are before removing drugs from shelf, before preparing medications for administration, and before returning the drug to the shelf. You never give a medication if you did not personally prepare it, because you need to know that that has been done correctly, that the 3 befores have been performed, as well as making sure that the checks on amounts and all of that are done. So I'm going to repeat that. You never give a medication that you did not prepare. Very important to remember always. Now the 7 rights go with the administration because it's the process of what you need to make sure are correct, or in quotations, right. So when you're administering a drug to a patient, first of all, you need to have the right patient, which means that you have checked the patient's information. Usually we do this through name and date of birth. We might even have a patient number that we check with. We make sure that we have the right drug. So we've already done our 3 befores and we have the drug, and we make sure that we have the correct one that was ordered. So you're checking the doctor's orders to the drug that's been prepared. You want to also make sure that you have the right strength of that drug, that you're giving the drug at the right time to the patient. Depending on what the order says, it might say administer 30 minutes before patient is to have their exam. So then you'd want to make sure that that time was correct. It might have an actual time like 10:30 a.m., but you want to make sure you're administering at the right time. You want to make sure you're doing it right route. So is it oral? Is it in an injection? So is it intermuscular or a subcutaneous? And then making sure that you use the right technique when administering the medication. And lastly, you want to have the right documentation. And that documentation needs to be correct for administering any kind of medication. So again, this is just a brief overview. I wanted you to have this in your knowledge base because it will help you in everything that we do. And next semester, you will be seeing these a lot. But again, in this pharmacology class and in your ALH4, you will be utilizing these techniques even sometime during these classes this semester. I will talk to you later. Have a great day.